Your mouth is a universe, a bustling, microscopic world of incredible complexity, and the presence of sugar changes its very atmosphere, its weather, its climate. There is no need for alarm, only for understanding. So for the next 30 minutes, let's take a gentle, fascinating journey into this world together. We will explore the simple science of what happens inside and how we can bring it back into perfect, peaceful balance. We start by looking at this tiny world through the eyes of science, but with a heart full of curiosity. Managing your blood sugar is a careful, daily balance. We often focus on the big organs, the heart, the kidneys, the eyes. But the mouth is where many silent warnings begin. By learning to recognize these small shifts, you gain powerful insight into your overall health. It is an act of proactive self-care. What is the main protector in this small universe? It is the clear fluid called saliva. Think of saliva as the great river of your mouth. It flows constantly, washing away debris, neutralizing acids, and carrying essential minerals that keep your tooth enamel strong. It is the mouth's natural defense mechanism, working tirelessly, especially when you sleep. But when blood sugar levels are often elevated, this river changes. It begins to flow less freely. The volume of saliva decreases significantly, and its composition becomes stickier and sweeter. The gentle, cleansing river begins to dry up. This leads us to the most common feeling many adults managing diabetes experience: persistent, dry mouth. Medically, it is called xerostomia, but the experience is simply uncomfortable. It feels like the inside of your mouth is coated with cotton, especially when you first wake up or right before you try to drift off to sleep. Have you ever noticed this uncomfortable dryness? When your mouth is dry, the tiny protective mineral shield on your teeth loses its main source of replenishment. The friction from eating, talking, or even resting your tongue causes tiny irritations. These small irritations can turn into sore spots that simply refuse to heal quickly. The absence of that constant, gentle flow of saliva also means there is nothing there to neutralize the acid produced by bacteria. This is where the story of the mouth and diabetes truly begins to connect. A dry mouth is not just an irritation, it is an open invitation for problems to settle in. It affects how dentures fit, how you chew your food, and ultimately, how well you rest at night. If this quiet, discomforting feeling resonates with you, know that you are not alone. And know that gentle action can make a great difference. One of the simplest and kindest things you can do to address a dry mouth starts right now. Before you settle down for the night, practice mindful hydration. Instead of gulping water quickly, which often sends it right through your system, take small, measured sips. Hold the water in your mouth for a moment before swallowing. This allows the water to coat the dry tissues gently, providing lasting moisture. Keep a small glass of water by your bedside, not to sip frequently all night, but as a calming reassurance. We are uncovering these gentle truths so you can feel empowered, not fearful. If you find this kind of slow, evidence-based health guidance helpful for your peace of mind and comfort, please consider subscribing to our channel. Your support allows us to keep crafting these calm, trusted narratives for better sleep. The change in your mouth's climate, the drying up of the great river, has another, even more significant effect. It fundamentally shifts the power balance of the microscopic life within. In the next chapter of our journey, we will look closely at this new atmosphere and meet the thriving, sticky community that loves a warm, dry, sweet environment, the biofilm of plaque. Understanding this tiny life is the key to bringing your mouth back to a feeling of clean, lasting peace. The new climate inside the diabetic mouth creates a perfect nursery for the community we call plaque. Plaque is not just a film. It is a microscopic city, a living community called a biofilm. This city is tough, sticky, and highly organized. It is constantly growing, building layers, and setting up defenses. What does the biofilm city need to thrive? Food. And unfortunately, the elevated sugar in the mouth's environment is the perfect feast. The sugar acts like rocket fuel for these organisms, allowing them to multiply and excrete acids that erode the tooth enamel. Think of the plaque biofilm as a tiny colony of workers who are constantly drilling, digging, and dissolving the environment around them. The bacteria that make up plaque are tireless. They work hardest during the night, when the flow of saliva is at its absolute lowest, removing the body's natural rinse cycle. This is why brushing and flossing right before bed is perhaps the single most important action you can take for your long-term oral health. You are literally disrupting the biofilm's nightly construction project. But the real trouble with this growing colony is not just cavities. The danger lies in how close this sticky biofilm gets to your gums. The mouth's response to the plaque's presence is inflammation. Your body sees the bacteria as an invader and sends its defense forces, creating redness, tenderness, and slight puffiness. This is the beginning of gingivitis, or simple gum inflammation. If your gums bleed easily when you brush or floss, your body is sending a clear signal. It is a sign that the delicate gum tissue is irritated and fighting back against the expanding biofilm. Ignoring this signal allows the problem to deepen. If this inflammation continues unchecked, it moves from gingivitis to a more serious condition called periodontitis. The biofilm, having grown thick and hardened, slowly starts to pull the gums away from the tooth. Tiny pockets form beneath the gum line, creating deep, dark shelters where the bacteria can live, protected from brushing and rinsing. These pockets are significant. They hold trapped food debris and massive colonies of bacteria. Because these bacteria are shielded, they produce high levels of toxins and inflammatory signals. This continuous, low-grade infection becomes a chronic wound. And this tiny hidden wound in your mouth has a direct and profound connection to the rest of your body, which we will explore in the next segment. So how do we dismantle the sticky biofilm city? It requires patience and consistency. The first tool is gentle, effective brushing. Do not use force. Instead, use a soft, bristled brush and concentrate on the area where the tooth meets the gum. Think of it as a gentle massage, not a harsh scrub. Use small, circular motions. You are aiming to disrupt the bacteria, not sand down your teeth. And never forget the power of water. After eating or drinking anything that isn't plain water, even a sip of coffee or a small cracker, swish some water around your mouth for 30 seconds. This simple act of mindful rinsing helps neutralize acids and wash away the initial food sources for the bacteria before they can settle down and join the biofilm. Taking these tiny, gentle steps disrupts the colonization process and keeps the terrain cleaner for a peaceful night. This is how we begin to restore the balance. The silent struggle beneath the gum line is not isolated. When periodontitis takes hold, those tiny inflamed pockets become open gates. They allow the high levels of bacteria and their inflammatory signals to pass directly into your bloodstream. This is the unseen connection, the core of the relationship between your mouth and your overall well-being. Your body is one single, interconnected story. The inflammation that begins as redness in your gums doesn't stay local, it travels. When bacteria enter the bloodstream, your immune system launches a global, systemic response. It begins to fight throughout your entire body. For someone managing diabetes, this is critical. When the body is constantly fighting inflammation from the mouth, it makes managing blood sugar much harder. This persistent infection, even a small, quiet one, causes stress on the body. This stress can lead to increased insulin resistance. In simple terms, the blood sugar levels can become higher and more unpredictable because the body is distracted by the gum infection. It is a two-way street, a reinforcing loop. High blood sugar causes the mouth environment to be less resistant to infection. Infection in the mouth then makes it harder to control that high blood sugar. This is why addressing mouth health is not just about keeping your teeth, but about supporting your entire metabolic system. This link extends far beyond blood sugar control. We now have strong evidence suggesting connections between advanced gum disease and other serious health concerns. The inflammation originating in the mouth is linked to an increased risk of cardiovascular issues, including heart disease. The bacteria from the mouth can potentially travel to the heart and contribute to inflammation in the blood vessels. This realization should not bring worry, but tremendous empowerment. Look at the power you hold in your hands every morning and every night. By performing gentle, consistent oral care, you are not just cleaning your teeth. You are actively reducing the systemic inflammation burden on your heart, your kidneys, and your blood sugar management system. You are acting as the guardian of the gate. What is the quiet response to this profound realization? It involves adding one more gentle tool to your nightly ritual: flossing or using an interdental cleaner. Brushing only cleans 3 surfaces of your tooth. Flossing cleans the remaining 2, the vital contact points between teeth where the biofilm loves to hide. Flossing needs to be slow and purposeful. Do not snap the floss against your gums. Instead, gently slide it between your teeth, forming a C shape around one tooth and sliding it slightly below the gum line. Use a fresh section of floss for each gap. This gentle action physically removes the bacteria that brushing simply cannot reach. If flossing is too difficult due to dexterity issues, ask your dentist about small interdental brushes or floss picks. The goal is easy, gentle consistency every single night. This is how we support our entire body from the quiet strength of the mouth. Sometimes, the challenge in the diabetic mouth goes beyond bacteria and inflammation. A common, quiet companion to a dry, sugary environment is fungal overgrowth. This condition, medically known as oral thrush, is an opportunistic infection caused by a yeast called Candida. Imagine the mouth as a lush, humid jungle. When the delicate balance of the environment is disrupted, when the river of saliva is low and the sugar content is high, the Candida yeast sees its chance. It thrives in these sweet, less defended conditions. Oral thrush often manifests as white, creamy patches, usually on the tongue, the inside of the cheeks, or the roof of the mouth. These patches can be uncomfortable. They can cause a burning sensation, especially when eating or drinking. Sometimes they lead to a change in taste, making foods taste bland or slightly metallic. Thrush is particularly common in those who wear dentures, as the dentures themselves can trap the yeast, providing a protected surface for growth. It also commonly affects individuals whose natural immune responses are lowered or those taking certain medications, like inhaled corticosteroids for breathing conditions. The key to managing this yeast overgrowth is twofold: control the environment and maintain cleanliness. The first step is always focusing on optimal blood sugar management. By keeping blood glucose levels as steady and predictable as possible, you are immediately making the mouth a less hospitable place for the yeast. You are eliminating its primary food source. The second immediate step involves gentle cleaning, especially if you wear dentures. Dentures should be treated as part of your mouth, requiring daily, mindful cleaning. After every meal, a gentle rinse helps tremendously. More importantly, they should be thoroughly cleaned and soaked overnight in a professional, non-abrasive denture cleaner, or even simply in warm water. Giving your mouth and the dentures a resting period allows the tissues to breathe and reduces the growth environment for the yeast. For those without dentures, focused tongue cleaning can be highly beneficial. The tongue surface is often where yeast and bacteria congregate. Using a soft bristled toothbrush or a specialized tongue scraper, gently brush or scrape the tongue from back to front before bed. Be kind to the tissue. You are not scrubbing a floor. You are gently sweeping away the accumulated film. This level of detail is necessary because understanding these internal changes gives you control. Knowing that a persistent bad taste or a slightly coated tongue is a sign of an environmental shift allows you to consult your healthcare provider or dentist with informed peace. You become an expert in your own body's tiny signals. Remember, gentle, consistent care is your strongest defense against the hidden changes happening inside. We are not treating symptoms. We are restoring balance. As we move towards a state of greater balance and health, we need to talk about the gentle art of professional partnership. Even with the best at-home care, the reality of managing diabetes means that specialized support is essential. Your dentist is not just there to check for cavities. They are a crucial partner in managing your systemic health. The hardened plaque, which we call tartar or calculus, cannot be removed by simple brushing or flossing at home. Tartar creates rough surfaces, where the biofilm finds it incredibly easy to cling and multiply, often right below the gum line where you cannot see it. Regular professional cleaning removes this built-up tartar, which instantly lowers the overall inflammatory burden on your entire body. For many adults managing diabetes, a standard annual or twice-yearly checkup may not be enough. The American Dental Association often recommends more frequent professional care, perhaps every 3 or 4 months, especially if you have a history of gum tenderness or periodontitis. This is not a punishment or an excessive demand. It is an act of gentle, proactive maintenance that supports your overall blood sugar control. When you visit your dentist or hygienist, approach the appointment with calm, open communication. Share your most recent blood sugar readings and any changes in your medication. Let them know if you have been experiencing dry mouth or if you have noticed any subtle changes in the fit of your dentures. This complete picture allows them to tailor your care precisely to your body's current needs. Your professional team can offer tools and treatments that go beyond what you can do at home. They might recommend specific, non-alcoholic prescription rinses to help manage bacteria during a flare-up. They can apply protective fluoride varnish to strengthen your enamel against decay in a dry environment. Or they might measure those tiny gum pockets to ensure they are not deepening silently. A key point of comfort is understanding that dental visits should not be painful or scary. If you have sensitive gums, let the team know, request breaks, ask for topical numbing gels. You are in control of your care. Making your professional visits a calm, predictable experience reinforces your commitment to long-term health, ensuring that your mouth remains a place of comfort and not a source of worry. This collaboration, your gentle care at home, combined with expert, regular maintenance, is the ultimate defense. It is how you ensure that the complex science inside your mouth remains balanced, peaceful, and supporting your well-being rather than hindering it. Taking this gentle approach transforms a necessary appointment into a deeply valuable act of self-care. We have traveled through the invisible universe of your mouth, explored the role of saliva, met the biofilm, understood the connection to systemic inflammation, and learned how to peacefully manage yeast. Now let's bring all these gentle insights into a single, cohesive action plan, a final set of steps you can integrate into your nightly routine tonight. Remember, the goal is not perfection but consistency. Every night you perform these steps is a night you are supporting your blood sugar and protecting your heart. First, focus on hydration and lubrication. Before you dim the lights, take 3 slow, deliberate sips of water. Swish the water gently to coat your mouth tissues. If dry mouth is a major concern, speak to your pharmacist about over-the-counter saliva substitutes. These gentle gels or sprays can provide hours of soothing relief, allowing you to sleep without the discomfort of cotton mouth. Apply a thin layer just before settling into bed. Second, the Mindful Cleanse. Use a soft toothbrush and low abrasive toothpaste. Focus on the area where the gum meets the tooth, using small, gentle circles. Take your time. We are replacing rushed effort with peaceful precision. Remember, brushing is the act of sweeping away the tiny acidic workers of the biofilm. Third, the interdental sweep biofill. Use floss picks, or interdental brushes. Do this gently. Do not rush. This is a meditative process. It is the crucial step that removes the bacteria hiding between your teeth, preventing the deepening of those sensitive gum pockets. If you find flossing difficult because of arthritis or dexterity issues, explore electric flossers or water flossers. Technology can be a wonderful, gentle aid in maintaining balance. Fourth, the final tongue care. A quick, gentle sweep of the tongue surface removes surface debris and resting fungi. A clean tongue supports fresh breath and a cleaner start to the morning. Fifth, the denture rest. If you wear dentures, ensure they are cleaned and soaking overnight. Give your oral tissues a full night to rest and recover. Never sleep with your dentures in place. This simple change reduces the risk of thrush significantly. These 5 steps, hydration, mindful cleanse, interdental sweep, tongue care, and denture rest, form your nightly protocol. They are small acts, but their effect on your overall health is profound. You are using the simple science we explored tonight to create a strong, internal defense. Taking control of these tiny details gives you tremendous confidence. It replaces nighttime overthinking about your health with peaceful, proactive action. You no longer have to worry about what is happening inside your mouth, because you know you have lovingly tended to your internal environment. We understand that adopting new habits takes patience and self-kindness. If you miss a night, simply restart the next evening without judgment. The goal is long-term, gentle consistency. If this exploration has brought you comfort and a deeper understanding of your body, please gently press the like button. Sharing this insight helps others discover the peace of mind that comes with informed self-care. May this newfound understanding lead you to a night of quiet comfort and profound rest. Sleep peacefully, knowing you have given your body the gentle care it deserves.